A recent client analysis that I did around this particular component on financial well-being, their average annual salary was $120,000 per year. They were saying, we don't think our people have financial stress. And so there are people that are maybe making $100,000 a year in a given zip code, but the cost of living for daily living of necessities could be 105,000.
You would think, well, if I'm under financial pressure, then I'm probably not going to be as present at work. I'm going to have sleep problems. I might have some additional mental health problems or anxiety, or there could be a whole host of actually health things that are impacted by the financial wellness or lack of wellness challenges that people face.
I think employers think they know their population, and they do know a lot about their population, don't get me wrong. But when you start to do the deep dive analysis down to the zip code level and compare that to a very statistically valid database like we have at Alliant, you're going to get insights into your employee population struggles from the social determinants of health aspect and overall well-being aspect that's going to allow you to implement targeted strategies that are going to make a difference in your overall healthcare costs, productivity, and employee engagement.
Hi, everyone. Welcome. Today, I have Tony Garavaglia here from Alliant. Tony is an SVP in the Employee Benefits Program over at Alliant and has a great history working with Willis Towers Watson, Mercer, and really just a ton of experience in the employee benefits space. So we're really excited to have him today. The topic for today will be talking a little bit about the benefits space and how employers really have the opportunity to better utilize population health data, social determinants of health, to really have more targeted strategies for their population. So excited to have you here today, Tony.
Thanks so much, Lindsay. Thanks for having me. I am, this is a topic I'm so passionate about, and I've been doing health and welfare consulting now for 32 years. And over the last several years, there's been a real focus in on looking at meeting, and maybe this is an overused term, but meeting employees where they are and the varying generational cohorts that exist within an employer population. And when I joined Alliant and saw that we were doing a lot of work around social determinants of health and actually digging into employee demographics to set strategies, it was a super exciting topic for me.
Is that unique for Alliant? Do most of the other firms focus as much there, or is that kind of a specific, focus for Alliant and something that's a differentiator for you guys?
I would think that most consulting firms are looking at generational overviews for all of their clients see to ensure strategies are implemented where it's meeting each of the different generational cohorts of an employer's population. But a differentiator for us in the way we approach social determinants of health is that we have access to the Johns Hopkins claims database, which has 4 trillion claims in it, trillion with a T.
Wow.
So there are a lot of claims in there to make it a very statistically significant comparison pool of claims. We marry that, our client demographic data, up to that claims data in the Johns Hopkins database. And that gives us information on many of the social determinants of health to help us set well-being strategies that are really targeted to our clients. So the differentiator being the access to the Johns Hopkins database that is just, it's a massive database to give us targeted strategies.
That's extremely interesting. Would love to hear a little bit before we jump in on, kind of your work with Alliant. Like, what's a typical employer that you would work with or that you've worked with over your career? Because I know as we're talking about targeted strategies for employers, all employers are obviously different. They're unique. I know that you're in St. Louis, so, there's different regional, demographics that also, play a part. So we'd just love to hear a little bit about, the typical populations that you're working with.
Yeah, I work primarily with larger self-funded employers that have employee populations scattered all over the United States and even globally. But from a well-being perspective, and for some of my clients, we do focus globally, but from the majority, we're looking primarily at U.S. Well-being and social determinants of health. And I would say my average client is probably in the 8 to 10,000 employee range, but it varies from employers with 600 employees all the way up to 100,000 employees. So it's a very wide array, but large majority, 99% of my clients are self-insured and scattered all over the United States.
That's super interesting. Awesome. Well, maybe then to kind of set the stage and get things going about the topic at hand. So, as you mentioned, this is something that a lot of organizations have certainly been looking at. But I think, sometimes it's integrated better than others, perhaps, And I think that what you said about having access to the Johns Hopkins data is super interesting. So, would love to hear a little bit about as you're working with employers, thinking about their 2026 strategy, for instance, what are some trends and things that you're seeing in the data that are popping out? And maybe also like what are some things that aren't necessarily always on employers' radars, but, should perhaps be thought about as they're planning for next year and they're really kind of looking to take their strategy a little bit further.
Yeah, two of the things that have popped out consistently and when I run this analysis for my clients that are eye-opening and a little bit of a surprise to my clients. One is adequate access to healthcare. And many of them say, why are we scoring so low in that area? We work with a really large BUCA plan, whether it be, Blue Cross, United, Cigna, Aetna. We have a large national network. If we look at the provider directory, 100% of our people have access to providers. So why are we scoring so low in that area? But what's happening is the providers, while their name may be showing up in the provider directory as an available provider, when we look at the claims data for example, Dr. Kratzer,
Mhm.
we see that Dr. Kratzer is completely overwhelmed with the amount of patients that she has. And so we're looking at that from an access standpoint. So while the doctor may be available in the network, they're managing so many patients that it creates an access issue. And that's eye-opening for our clients because they don't really think about they think if the provider's there, they're available, but they're not taking into account the saturation of the provider market. And many providers are moving into concierge medicine and limiting their patient load from 3 to 4,000 patients down to 600,
Mhm.
which is creating an access issue. The other that comes out quite a bit is economic instability by zip code. And so when you have a population scattered all over, and if your total rewards package or your comp package isn't accounting for not only the cost of care in a particular zip code, but the cost of living in a particular zip code, this analysis looks at income of the people within those zip codes versus the actual cost of living and the cost of care. And that leads into well-being strategies around financial well-being and which to me there are many pillars of well-being. Well, physical is one that most people think about, but social well-being, emotional well-being, and then financial well-being. And I'm super passionate about financial well-being because I think it's the pillar that holds the other ones up.
Mhm.
Because if you're drowning in, debt, or you can't pay bills, or you have medical debt, or, whatever, you're not going to sleep well because you're worried. And if you're not sleeping well, you're not going to get up and go to the gym to take care of your physical well-being. So to me, the financial well-being component, often a surprise to our clients, but an extremely critical component of the well-being platform.
Yeah, I'd like to dig into both of those. Maybe first starting with the access issue. That's something that I'm very well aware of. I spend a lot of time in the direct primary care space. And to your point, so many providers, there's a provider shortage, obviously. And then, as those panels shrink and people spend more time with the patients, there, are other challenges that come about. And so one of the things that the company I worked for many years did was really helping to solve and address a lot of those access challenges, and that was always something that was kind of a surprise. It felt like to employers. What else might be driving some of those overall access challenges that employers have? Because I think that maybe that's a topic that's been talked about for a long time, and employers oftentimes, to your point, think that that has already been solved for, or that it's not as big of a problem, and maybe they don't always understand the downstream impact that a lack of access to healthcare can really drive for their populations.
Yeah, there just continues to be a perception from employers that there is adequate access, but when you talk to employers and or employees and you look at claims data and you look, doctors are very saturated and employees, we want them to get their preventive care. We want them to call their primary care physician when they have a sinus infection rather than going to the ER or an urgent care. But what's happening is they're calling, they're not able to get in for those simple, things. And the doctor will say, just take something over the counter, or they'll advise them to go to urgent care or ER, depending on the situation. And that leads to higher cost care through urgent care or emergency room utilization. And, that's why, direct primary care, and I'll even say advanced primary care, more and more of my clients are looking at doing that. If one of the things the pandemic, something good that came out of the pandemic was people being more comfortable having virtual interaction with one another. And so leading to, if I'm sitting in a virtual doctor's appointment, it doesn't feel as strange as it did prior to 2020. So we're looking at some creative ways to get people to utilize primary care in a more cost-effective manner,
Yeah.
than just going to urgent care or the ER because they can't get into their primary care for 6 weeks,
Right.
or sometimes 6 months.
Mhm.
So
I love that. Yeah. During the pandemic, I actually was part of rolling out like a huge suite of virtual products. And one of the things that we saw the greatest uptick with was obviously virtual mental health, which has obviously, become, much bigger, in the, last 5 years, obviously. But as you think about, kind of to your second point on the emotional and financial aspects and things like that, it seems like obviously services like, virtual behavioral health have made access easier for some of the emotional services that people may need as part of their well-being and their health. You mentioned financial, and I think that that's very, very much top of mind. I kind of always hear that stat that like 50% of Americans can't afford an unpaid, like an unexpected $500 medical expense. And I know that's a huge challenge for people. And, as employers have had to shift more of the cost burden with the rising, cost of care over to employees, that's obviously continuing to become a bigger problem. And I think, employees and their families are kind of facing this affordability crisis with healthcare. Would love to kind of hear a little bit more about how you guys look at that for different populations. And to your point, are you seeing that kind of across all different types of populations? Because you think low wage workers, but you mentioned, that there's these expensive zip codes that people may live in, and maybe they're more typical, like middle class types of populations that, are still struggling with a lot of these expenses because of the rising cost of healthcare.
yeah, it's one of the data points, a recent client analysis that I did around this particular component on financial well-being. Their average annual salary was $120,000 per year. And they were saying, we don't think our people have financial stress.
Mhm.
And when we put it down to the zip code level and aligned it with the cost of living indexes and cost of care in those particular zip codes, they actually had about 15% of their population that we were able to assess was feeling financial stress, because what it's doing is looking at the cost of, an average, maybe like a two-bedroom, two-bath apartment in that particular area, and doing a debt to housing percentage calculation. And so there are people that are maybe making $100,000 a year in a given zip code, but the cost of living for daily living of necessities could be 105,000. So and this varies widely by zip code. So it helps us to determine the economic gap down to the zip code level. And it's very eye-opening to our clients who, if they're just looking at their average salary and sitting in a lower cost area like St. Louis, where the cost of living is relatively low, $120,000 a year salary sounds very good. Well, if you're living in San Francisco, a very high cost of living, $120,000 a year is extremely challenging. So it's eye-opening, but and I know people know this data, off the top of their head, but when you look at it down to the employee level and where their percentage of the population is struggling financially, it's eye-opening to see the large percentage of an organization that is under financial stress.
I think that's illuminating that you referenced kind of the $120,000 because, I agree. Like most, employers may think this isn't really a problem in our population until you actually show them the data that proves it. Kind of thinking off of that, I think that sometimes, these factors have not, been as recognized because, I think employers are oftentimes focused on what's the ROI associated with rolling something new out, or what is the cost savings opportunity associated with this. And I think to your point earlier, you would think, well, if I'm under financial pressure, then I'm probably not going to be as present at work. I'm going to have sleep problems. I might have some additional mental health problems or anxiety, or there could be a whole host of actually health things that are impacted by the financial wellness or lack of wellness challenges that people face. How have you kind of presented this to employers when they're looking more in terms of, cost savings for their healthcare spend? How have you kind of tied the two things together to maybe get them to perk up their ears when they might not have before?
Yeah, there's some additional data that comes along with the analysis that shows the financial impact on various disease states. So, and you mentioned many of them as you were talking just now, that mental health and well-being, when we take the health scores that we determine out of this analysis, we then convert it over to, now how is this impacting your healthcare spend by disease state. We're also looking in the analysis, and mental health tends to be one of the bigger bubbles, if you will, of high costs within any analysis. But we're also looking at things like, in the zip codes where their people live, do they have access to parks to walk, to get outdoor exercise? So that would equate to physical inactivity cost bubble. And then there's also looking at, do they have access to healthy food options when the zip codes where they live? Or are they in a food swamp where, it's unhealthy food? They have access to plenty of food down, a main boulevard, but it's all unhealthy options. And so that equates to nutrition and obesity, diabetes. There's a whole host of other health conditions that come into play. So then we take their actual claims data to marry it up to see what is driving the cost based on what we think. And that allows us to put in targeted point solutions or other programs that can address some of these cost drivers.
That's awesome. I love that. I've always been fascinated by kind of the space of like food as medicine, lifestyle medicine, longevity, but kind of the concept that, all of these things really impact, the prevalence of Western disease and what people are experiencing. And if you can change the environment for many people, then, you could really prevent a lot of these downstream negative effects. So I think that's super interesting that you guys are taking that approach.
Yeah. It's really awesome to do the analysis too, because there's always a light bulb for us, even, like we go into an employer with a particular, like, I don't know, making this up. These are highly compensated, highly educated people. Everything's going to look good. And then we do the analysis and it's eye-opening to see how many things are not good.
Mhm.
So, that we can impact, which is why I'm here and why I do my job every
Yeah.
single day.
Yeah, I,
So.
I think maybe before we wrap up, I'd love to hear like an example, if you don't mind, to that point of, an employer where, this was kind of a light bulb moment and maybe like what they did differently coming out of this, like maybe changes that they made based on kind of the data once they really kind of understood it at a deeper level.
Yeah, and the one that I mentioned where their average salary was 120 and they felt nobody had any financial stress. And when we did the analysis and saw that, around 15 or 16% of their population was feeling that, we've been working with them to, well, and also they had a well-being reimbursement program where they offered up to $500 for like gym reimbursement and traditional physical well-being things, and we're actually converting them over to a lifestyle spending account that allows more flexibility for the employer to offer funds to the employee population. They can still define the guardrails around it, but it doesn't have the limitations of a flexible spending account or a health savings account. It's the employer putting money into an account, still defining the guardrails of what the employee can utilize the money for. But one of them, for example, that we're setting up is financial counseling, that they can take the money that's in their lifestyle spending account and utilize it towards a one-on-one financial planning session with their financial well-being vendor. That, something like that. And there's really no limit into how an employer can define what is included in this lifestyle spending account. And it's been as a result of the analysis we did around their financial well-being.
That's awesome.
I mean, I would just say in summation, I think that many employers, social determinants of health and geographic determinants of risk are a very hot topic and a buzzword in health and welfare consulting. And I think employers think they know their population, and they do know a lot about their population, don't get me wrong. But when you start to do the deep dive analysis down to the zip code level and compare that to a very statistically valid database like we have at Alliant, you're going to get insights into your employee population struggles from the social determinants of health aspect and overall well-being aspect that's going to allow you to implement targeted strategies that are going to make a difference in your overall healthcare costs, productivity, and employee engagement, and therefore leading to better retention and improving your overall employee value proposition.
Yeah, I love that. I mean, I love that you mentioned buzzword as well, because, this has been a buzzword in many places, but, obviously we've seen that people have responded well to culturally competent care or care that's really more targeted for the individual. And I think also to your point, you're working oftentimes with, nationally geographic diverse populations or global populations. It would be very hard for an HR leader sitting in headquarters to fully understand the full population, even if they are looking at data, and they don't always have the resources to do that either, right? That's oftentimes
Right.
what
Right.
employees are looking to, their really strategic relationships with their brokers or consultants to help them with, right? So it seems like this is a big opportunity to really illuminate, an unmet need for many employers. They don't even fully recognize kind of the challenges around. And then, you would think that having a more targeted benefit strategy should yield better results, better outcomes, more cost savings, more engagement from people as well. So it seems like a no-brainer to me.
Yes. Yeah. And you can tell it's a very, really passionate topic of mine, and I love doing it.
Well, wonderful. Well, thank you so much for coming on, Tony. This has been super interesting
Thank you.
conversation. And I look forward to sharing it with everyone.
Thanks for having me, Lindsay. I appreciate it.